I gave up smoking because I wanted to give up smoking for my health and for my own well-being. The children were definitely a motivator because, as I said earlier, I didn't want to be a hypocrite and ask them not to smoke or not to vape when, I was smoking myself. But I think if you're thinking about giving up smoking, it's very important you give up smoking for yourself, not give up smoking for anybody else, because it's a very hard thing to do. You need to give up smoking because you want to give up smoking.
Welcome to the HSE Talking Health and Wellbeing podcast. My name is Noreen Turley, and today I'm talking about tobacco and vaping with Dr. Paul Kavanagh, our public health medical expert for Tobacco Free Ireland programme, and Sarah Halpin, who is working at community level to support people to quit smoking. So welcome and thank you very much for being here with us today.
Thanks for having us.
So Tobacco Free Ireland is something that has been in place for the last 10 years. And we know we've come a long ways in the last 17 or 18 years since the banning of cigarettes in public places. But today we want to talk about what next, smoking, vaping, quitting, and what we're going to do about the figures. And we know that our numbers are still at 18% of people in Ireland still smoke. So first of all, I was going to talk to Sarah, who has given up cigarettes. And I just wanted you to tell me a little bit about your story, Sarah, how you gave up cigarettes and how you got to where you are.
So I gave up smoking about 6 years ago. I was a heavy smoker for about 30 years, smoked between 20 and 30 cigarettes a day. Then I had 3 children. My children were becoming kind of up to that teenage years, and I used to smoke outside the back garden, and I'd see their little faces pressed up at the window, and I just thought, this has got to stop. It's not healthy for them to see me smoking. I can't ask them never to smoke if I'm smoking myself. So I thought, right, I need to do something about it. So I didn't find it as easy as I thought I was going to. We have courses that we run in Balbriggan, and they start in January, and then they start again in September. So I initially was going to join in September and start, and managed to talk myself out of it because I loved smoking, and sure, really what harm was I doing and all of that. So I waited, and then the January came along, and I thought, right, it's now or never. So I joined.
And how did you know where to go? How did you find that?
Well, I was aware of quit.ie, through the radio and television. And we have a local partnership in Balbriggan, Empower. And I knew that they were running courses. There was posters around, and it was on social media, things like that. So I knew where I could go. It was just kind of taking the first step to go, which I did in the January. And I think because I had been a stay-at-home mum for so long, I'd kind of lost a bit of confidence. So I went along on my own, and it turned out I wasn't as ready as I thought. I did quit, but I had a couple of relapses, went back on smoking, and I did complete a 12-week program, but I wasn't happy with how I had done. So I came away, smoked more than I had smoked previously, which, is to be expected, I suppose. And I rejoined the course, and I rejoined the course with a much better mindset. I knew it was going to be very difficult. I knew I would struggle, but I think I mentally had prepared myself for that. And on the programs that we run, we kind of ask people for a quit date on week 3. And it's basically so people can get the same level of support. They get a longer amount of support.
Sorry to interrupt you there, but just to go back to you as a smoker. I know you're teaching the We Can Quit program now, but go back to you as the smoker. Tell me how you felt. Did you tell anybody that you were going that day? How did you feel? You said your confidence had dropped. You were at home mum. I can completely relate to that because I've been at home mum as well. And how did you feel walking into the room that day?
I was very nervous, very, very nervous. It was horrible. I kind of pulled up in the parking lot. I sat there for a few minutes, and I thought, again, I nearly talked myself out, and thought myself, said to myself, really, is smoking that bad? And sure, I'll be grand.
And when you walked into the room?
Well, it was very welcoming. There was a lot of people there, and there was 2 facilitators there, and they came over and introduced themselves, told me I was very welcome. So immediately put me at my ease, told me to take a seat, and I felt welcome. And then it came to, we'll introduce ourselves. And again, I was really nervous and I couldn't listen to anyone else's information because I was so focused on what I was going to say.
You were trying to remember your name.
I was, yeah. Yeah, I was. It was horrible. And then I just settled in and I found I got such great support from the facilitators. The following week, I wanted to go back. And to answer your earlier question, yeah, I told everybody because I needed to be held accountable. I wanted everybody to know that I was quitting or, and that way if anyone seen me, that they could just constantly ask me about it. So I wanted to shout it from the rooftops.
So actually. you really exposed yourself then. So if the kids saw you, so what the first time then the kids did see you smoking, obviously. So did you feel guilty about that?
Oh, I felt so guilty. I felt like I had let the children down. I'd let myself down. I just felt I was a hypocrite. Felt I was just a really bad parent. But
you kept at it and you went back.
I did go back. Yeah, I did because I really did want to quit smoking, but I just didn't have the confidence.
Yeah.
So I did go back. I'm so glad I went back. And I found the group really, really supportive and really helpful.
And apart from the support, what else did you get? Is there medication or there's different things that you can help you?
You get a 12-week supply of nicotine replacement therapies.
Very good.
For most people, that would be a patch. And you can get a 24-hour patch or a 16-hour patch, and it just slowly releases nicotine into your body. And then you get an aid as well. So for me, the first thing in the morning, I found very difficult. I really craved a cigarette first thing in the morning. So I had an aid, and my aid at the time was chewing gum. So you'd have the chewing gum, swallow, and then you'd park the chewing gum in the side of your mouth. So that worked for me. So there are there's about 5 or 6 different aids. There's lozenges, there's the mouth spray, there's an inhalator.
So did you try them all?
No, I didn't. No, the chewing gum worked. I tried the inhaler, but I don't know. I think I expected to have a plume of smoke come out of it or something. Yeah. And it didn't. But a lot of people would like the inhalator because they have the hand to mouth.
Okay. Yeah, the action that they would be used to using.
Yeah.
And Sarah, then there's something with quit.ie, don't the support workers keep in touch with you on text?
Yes, I think they give a weekly text to everybody just to see how they're doing and check in with people.
Yeah. So you've moved on now and you've started working with the whole Quit program and working in We Can Quit. How did that happen?
Yeah, so my facilitator, when we, at the time, a lovely lady called Jean, done a really great job, I have to say. And she works within the Empower organisation. And I suppose when I quit smoking, there were other options open to me that Jean would have put me in touch with. So there was a Healthy Food Made Easy course. And then there was the We Can Quit, and they were looking for people to train to become facilitators. And Jean asked me, would I be interested to do that? There was about a year and a half later. But because the course I felt was such a worthwhile, it's a great course. It's so supportive. It's so non-judgmental, which I feel is really important. Plus, financially, you'll get the help with the NRT for people that don't have a medical card. So I was absolutely delighted to go and train and become a facilitator. And I love running the courses. It's so rewarding.
So Sarah, that's kind of amazing. You said to me at the beginning that you were an at-home mum. You had no confidence.
No.
You were sitting in the meeting. You had to remind yourself what your name was. And now you're standing up in front of people who want to quit smoking and you are delivering the course.
Yeah.
That's really quite incredible. That's an incredible success and achievement.
Yeah, it's huge from where I started. The first night walking into the We Can Quit program as a participant, it's just opened my whole world, giving up smoking.
So it's not just giving up cigarettes. It's your confidence, your kids.
Myself of pride and, the empowerment I feel. And giving up smoking is one of the hardest things anyone will ever do. It's really difficult. So I think if you can overcome that habit, you can really do anything.
Do you think people really understand that smoking is an addiction? Or do they think they just assume that alcohol is an addiction or drugs are an addiction? Do they really understand that smoking is an addiction?
I don't know if they understand fully. I mean, to my knowledge, nicotine is stronger than cocaine.
And we'll talk to Paul a little bit more about nicotine.
Yeah. So, I mean, there's places, that you can go if you have a drug addiction. And I think tobacco is a huge addiction, and it's longevity as well. People smoke for such a long time, they don't realise the damage they're doing.
Yeah.
But I think it's a very hard thing to quit, but I think the group support really helps.
So you're now the facilitator for We Can Quit.
I
so
am.
What's your role now? What do you do? What's the course about? How do you structure your course to make sure that you can get the success that your facilitator got with you?
So basically with the course, we're a 10-week course. The first 6 weeks we follow kind of like a participant handbook, and there's a different exercises in the book, and each week we'll focus on your smoking triggers, your smoking habits, things like that. So it's quite structured for the first 6 weeks. And then for the last 4 weeks, we would have what we call open sessions. So we would have experts from different fields would come in. So we would always try and have somebody in to talk about stress and how to handle stress, because giving up smoking obviously is very stressful.
And Sarah, sorry to interrupt you there, but you did mention to me when we spoke before that you found it more stressful when you were smoking than since you've given up, which I would have assumed that everybody says, oh my God, I smoke because I'm so stressed.
Yeah.
So I found that really fascinating, really.
So I started a group last week, and I had 2 ladies there, and they lead very stressful lives. And they said the reason they smoke, is to relieve the stress. And I sat down with them and I explained that when you have a cigarette, your blood pressure actually rises. So you're making yourself more stressed. And I explained to them, it's not the actual cigarette that de-stresses you. It's the deep breath in and out.
Yeah.
In and out. That, because I figured that out myself when I was quitting, I realised. So what I used to do was I used to still go out my back garden and sit down for a couple of minutes, and I used to do my deep breathing.
Very good.
And also I kind of help people to understand smoking is very stressful because it's become very antisocial. So if you go into a social situation, the first thing you do is you're looking for your exit to go and have a cigarette somewhere. So you're all the time, on tender hooks. You're nervous about where you're going to smoke, when are you going to smoke, are people going to look at you if you're walking out of the room to have a cigarette?
Yeah.
Whereas when you give up smoking, there's a whole new sense of freedom. You don't care where the smoking areas are. And I remember my first holiday when I had quit. I was quit about 8 months, and we went foreign, and I was really super nervous. And
what were you nervous about?
I was nervous because you imagine you're sitting on a sun lounger with a cocktail in hand, and you're having your cigarettes.
Yeah.
And I thought, who am I without smoking?
Yeah.
So I was very nervous going. And in actual fact, what happened was when we got to the airport, we went straight through to security. We didn't have to wait until I had my last cigarette. When we landed, I wasn't running to get my luggage, so I could run out and have a cigarette. So the whole experience was just much more calm.
Wow. And I think I heard maybe that your husband also gave up cigarettes at the same time as you in support, which I think that is amazing, because I would assume that would make things so much easier. I'm not saying it's easy, but it would help.
Yeah, well, some might say I'm bossy, but I did say to my husband, if I'm going to do this, I'm going to need you to do it with me, because I wouldn't have been able to quit and have my husband walk out to the back door, even though you close the door. The smoke is everywhere. So I said, if I'm doing it, you're coming in with me, buddy.
And how did he respond to that?
He said, yeah, absolutely. He'd support me. He's a great man. So he was brilliant. And he quit too then.
That's fantastic.
We went through the program together. I attended, obviously, the weekly sessions, and, I'd show him the book.
And there's a program specifically for men now, and
now
We Can Quit.
Now they've started to run men-only programs, and then they have mixed gender programs as well.
Okay, and do you think that's better? Do you think that men just assume these programs are for women? Oh, it's a women's group. So is it good to have men in the?
It's really good to give men the option. Why would you not?
Yeah.
There's no reason why men.
Do you deal with them differently when they come into your group?
Nope.
No.
Absolutely not. I think it's very important on the first night of any course that I start. I think it's very important to make people realise I understand that
Yeah.
it's going to be a very difficult road ahead for them. It's very important they understand that the support will be there. You know, I'm always there. I always tell people I'm at the other end of a phone call.
Yeah.
And I'm sincere.
That's a lot of pressure, Sarah, though. That's a lot of pressure.
No, it's not a lot of pressure at all, because most people, once they know you're there, they don't feel the need then to ring you. So it's putting people at their ease. When the participants quit on week 3, we would give them a weekly phone call or a weekly text message between weeks, just to say, you know, I hope you're doing well. Keep going. Just a little bit of encouragement. And then, of course, the nicotine replacement therapy is fantastic.
Yeah,
you know,
that's brilliant. That's a great story, Sarah, and that you and your husband have given up together.
Yeah.
We know you can save up to X amount of money a week if you give up cigarettes.
Yeah.
And for you, was that was the financial incentive there for you to give up cigarettes?
Absolutely no. To be honest, no, it wasn't. I think when I was a heavy smoker, cigarettes could have cost €50 a packet and I still would have smoked. I only really got to terms and appreciated the financial benefits about on week 8, week 9, when I was actually saving money. I think when you're a heavy smoker, you will find the money to smoke, you know, irregardless of how much a packet of cigarette costs. But I will say, when I gave up smoking on week 3, by week 4, I had an extra €140.
Wow.
So that was my saving, because, of course, my husband gave up with me. So we saved €140 a week. Which was a treat for the kids, which was a day out, which was Sunday dinner. But no, at the start, it wouldn't have been. My motivator, I think, at the start was definitely my children. But it was something, I gave up smoking because I wanted to give up smoking for my health and for my own well-being. The children were definitely a motivator, because, as I said earlier, I didn't want to be a hypocrite and ask them not to smoke or not to vape when, you know, I was smoking myself. But I think if you're thinking about giving up smoking, it's very important you give up smoking for yourself, not give up smoking for anybody else, because it's a very hard thing to do, and, you know, you won't be able to do it. You need to give up smoking because you want to give up smoking.
Very good.
And you can't be pushed into it. You have to be ready.
And Sarah, when you say it's improved your health, it's made a difference to your health, in what way has it made a difference to your health?
I suppose, you know, it would have helped with my breathing and walking. You know, my energy levels would really have increased. Yeah, my hair and my skin. And actually, I would always say to people on the night 1 of the Week and Quit programme, you should take a picture of yourself now, as in when they go home, and then compare it at the end of the course, and you'll see a great difference in their skin.
Wow.
So smoker skin's quite grey and a bit washed out, but when people give up smoking, we can see it. We can see the difference.
That's amazing.
Yeah, so there are an awful lot of health benefits. Fantastic. And it's a great sense of achievement, I'll be honest.
Wow, that's amazing. So I wanted just to talk to Dr. Paul Kavanagh now, who is our Public Health Medical Advisor for the Tobacco Free Ireland programme. So Paul, that was a very interesting story from Sarah, and there was a lot of pointers there. Was there anything you'd like to add to that, or that you picked up on that you'd like to comment on?
Yeah, no, look, well, Sarah, that was a great story from Sarah, and look, very, very hard act to follow now in terms of, you know, talking about the problem. When you hear firsthand what somebody's experience is, you know, I'm very generous of Sarah to share that with us. But, you know, as she was telling the story, there were a few points that really resonated with me that I think are worth reflecting on. So, look, one of the first things that Sarah spoke about was her motivation, and getting really clear on her motivation to quit. So Sarah was telling us about the concern that she had in relation to her children, and the fact that maybe she was setting a negative role model and that they might think, well, look, if I can see my parents smoking, maybe that's something that I would do. So that wouldn't be unique to Sarah. That would be a common motivator that we would hear from people who smoke that are interested in quitting. But I think for somebody who's going to make that journey to quitting, getting really clear on what the motivation is one of the most important things they can do. And it was very interesting to hear that from Sarah. I mean, the other thing that struck me from Sarah's story was she really spoke about the sort of complex way that smoking is tied up with day-to-day life. So, habits, routines, she talked about the psychology of it. And then she talked about the physical addiction that there is with smoking as well. So I thought that was really interesting. One of the things that I thought Sarah was really honest around, and I was, considering this as Sarah was speaking, and I think within the programme this is something that we are honest about, but I think it's very important that we do make it clear to people, as Sarah said, quitting is really difficult. Like we want to help people and we want to make it as easy as we can for them, but it's really difficult. And the reality is that if somebody has been smoking for years and years and they make their first quit attempt, they may not be successful with that first quit attempt and they may fail. But then I think what was really interesting was how Sarah told us that although she failed, that had an impact then in terms of she kind of learned something from it, and it sort of redoubled her efforts as well. So I thought that was interesting.
We know that smoking is the biggest public health challenge in our lifetime. We know that our numbers, as I said before, our numbers are still at 18%. And I suppose what I want to know is, in the last 10 years since Tobacco Free Ireland, where have we come from? And then maybe we'll explore about where are we going to.
We have made good progress. If you look at where we were back in the late 90s, probably about 1 in 3 people smoked. In terms of where we are at the moment, with the most recent Healthy Ireland survey, which is a check-in that we do with everybody once a year in the country about their health. We take a sample of them, we ask them a number of questions. We would find back in 2022 that smoking has reduced. So it's now running at about 1 in 5 people, or 18%, versus, as I said, being 1 in 3 back in the late 90s. So that's great progress, and that's progress we've all delivered together. Obviously there has been policy leadership in terms of legislation. You talked about the smoke-free workplace ban. Think about things like plain packaging as well. So that's helped. Obviously the work that the HSE does help as well. But I think as a society, that's something that we've all brought about because we've all changed our collective attitudes and norms towards smoking. So we've helped that. But in terms of where we are at the moment, I don't think that the problem has gone away. Not by a long stretch, 1 in 5 people still smoking. And actually what's a little bit worrying for us, those of us working in the HSE around tobacco control, is that smoking prevalence appears to have stalled over the last number of years. So if we look back to where smoking was before the pandemic, it was similar to where it is now in 2022, 23. So it's around 1 in 5. Yeah. So, really it underscores that we really need to double down on this problem.
And Paul, one of the other things that I'm aware of is that it's the first time in 25 years that the smoking prevalence in children has increased. So that is extremely worrying.
Yeah, no, look, absolutely, that's right. And, we may come on and talk about some of those trends in terms of things that are going on around smoking and, of course, vaping and young people. But absolutely, those trends in terms of the fact that we haven't seen continuing reductions in smoking prevalence in children and young people, and the fact that we have seen an apparent stalling in smoking prevalence across the adult population, it just really underscores the fact that we need to double down on our efforts and try and bring this problem to an end. Because, when we step back at it and look at it from the perspective of the public's health, each week in Ireland, there are 100 people die from smoking-related harm. So that's more than enough to fill a double-decker bus.
Just when you mentioned that more than 100, I've heard a figure, now you can correct me if I'm wrong, but I heard a figure that more people, even through COVID, since the beginning of COVID, more people died of smoking than COVID.
Yes.
And we were up in arms. We were so disappointed with the number of people who died of COVID. And we're still seeing those deaths from smoking.
Oh, absolutely. And obviously, COVID has been a big impact for us all and a big impact on the public's health. But, when you stand back from it and look at it from the lens of population health and think about this problem over a number of decades, actually the scale of impact on public health from smoking is huge. So as I said, there's around 100 deaths per week. There's 1,000 hospitalizations each week in Ireland that are related to smoking and the harm that causes. And just to put a picture on that, that's equivalent to about 5% of our bed capacity in our acute hospitals. So that would be the equivalent of, say, St. Vincent's in Dublin or University Hospital Limerick, full on a day-to-day basis with people who are there because of smoking-related harm. So, like, this remains, despite the progress that we've achieved collectively, this remains a huge public health problem.
So, Paul, are we just talking to deaf ears? Are we not getting through to people? I know we've started a new campaign in the HSE at the beginning of the year. So is it making any difference? Do they realise that nicotine is a drug, that they're addicted to nicotine? To me, I think it's all about the nicotine.
Yeah. Well, I think one of the features, and it was interesting you were talking about COVID. So if you step back and think about it, I suppose one of the features of the epidemic of smoking related harm, and we would use that term, we would talk about it as an epidemic, is that it has moved slowly over time. And if you compare that or contrast it with something like COVID, sure, there we were in the matter of a few weeks or a few months, and this thing was huge and was impacting our lives. So something that moves very quickly like COVID, that has a sense of urgency with it. But I think back to your question, Noreen, the real challenge for those of us who work in trying to tackle the harms caused by smoking is trying to keep that urgency around it, because it's such a slow moving problem, and everybody will think, oh, but haven't we done that? Haven't we done the the smoke-free workplace legislation? Haven't we done plain packaging? Haven't we got the ads on the telly and so on and so forth?
Exactly.
But really, we need to keep our focus on this, not least because, as you said, there are stalling trends in the population generally, but also from the point of view of the next generation as well. So I was really interested to hear about Sarah talk about the concern that she had that her own smoking maybe was setting a kind of a negative role model for her children. And I think we would all really want to protect children in terms of the huge harm caused by smoking, and the fact that we've seen those trends in terms of no longer seeing that reduction in smoking among children and young people, and in fact concerned that may be turning up again somewhat, that really underscores the fact that we need to focus in on this. Yeah.
And obviously a key thing at the moment is with young people is the vaping. I mean, vaping is everywhere. They're vaping in the bathrooms at school. There's vaping on the way to school in school uniforms. And it's so distressing to see the number of kids. But do they really know what vaping is? Is there mixed messages out there? Do they think it's just a nice pink, cool thing to do, to hold in your hand that matches your outfit, and the smell is lovely and the taste is lovely now? You can get it whatever flavour you want, and you can buy them. I mean, what are we doing about that?
Yeah, no, look, Noreen, I think you've characterised it really well. I think this challenge around vaping and e-cigarettes is something that has kind of come up on us very quickly. It's evolving around us, and it's pretty complex. And I do think that there have been sort of mixed messages and maybe gaps in communication in relation to the risks that are associated with this. So I think it's probably helpful just to start with a few facts.
Yeah, so I think so, because we have a couple of different parts of the community or the population that smoke. We have the kids that are smoking, but in a lot of countries they're advising that people should use vapes or e-cigarettes to give up smoking, and we're not advising that.
No.
So did they know something about the vapes that we don't know, or the e-cigarettes that we don't know, Paul?
No, look, interesting, Noreen. I think you've kind of struck to the heart of some of the complexity and maybe some of the mixed messaging that there is around e-cigarettes. So just in terms of the facts, so like what are we talking about here? E-cigarettes or vaping, that relates to people inhaling a heated liquid that contains nicotine. So they're receiving nicotine through that. Now, they're not burning tobacco to get nicotine, so they're not exposed to all of those noxious chemicals that we know are associated with burning tobacco. But there are still concerns in relation to the harms and the health impacts around it. In terms of where we are in relation to statistics and how many people are vaping in Ireland. So, when we look at the Healthy Ireland survey, which I spoke about, that would tell us that about 3 to 4% of the population who are aged 15 years and older are vaping, and mostly they are people who are currently smoking or are ex-smokers. However, we have seen a rapid increase in vaping among younger adults, so people that are aged 15 to 24. In fact, we saw a fourfold increase over recent years. So back in 2015, about 1% of people in that age group would have used e-cigarettes. It's gone up to about 4%. Then when we look at children, and I think one of the best sources for us there is the SBAD study, which is a study done in Ireland and other European countries looking at the experience of children and young people in schools, particularly when it relates to different sorts of substances that may be addictive. So back in 2015, when we looked at Irish children through that SBED survey, about 1 in 10 of them would have been regularly using e-cigarettes. That has increased in 2019 to 1 in 5 or 18%. And particularly that increase was among boys, and that was linked to the point that you made, Noreen, around the increase in smoking as well.
Yeah, and sorry to interrupt you, Paul, because we know now that if cigarettes were being introduced in 2023, it just wouldn't happen. So how did this happen? How did all of a sudden, even when Sarah gave up cigarettes 5 or 6 years ago, there was no vaping, and all of a sudden it's everywhere. How did it happen?
This has emerged very quickly. So we know that there's an industry behind this. And in fact, interestingly, while the industry, when it was initially established, that was producing e-cigarettes, was independent, we know that over time, those industries have been increasingly bought out by the tobacco industry. So the tobacco industry has a huge stake in the production and the sale and the promotion of e-cigarettes as well. So that is quite worrying. So from the HSE's perspective, when it comes to talking about e-cigarettes, I think it's best to break it down and think about it from the perspective of what this means for children and young people, and then what this means for adults, particularly adults who maybe are smoking and are wondering, might using an e-cigarette help me to quit? So from the point of view of children, I think it's very important that we are absolutely clear with people that e-cigarettes are associated with harm for children and absolutely no benefits. So when I say harm to you, Noreen, what I mean there is, as I said, e-cigarettes, they release nicotine. We know that nicotine is very dangerous for children and young people. So we know it is highly addictive, a point that Sarah made already. We know then that nicotine has particular effects on the developing brains of children and young people. So it has effects on their attention. It has effects on their impulse control. It has effects on their mood as well. There are other health effects as well in terms of the exposure of developing lungs to the vapour from e-cigarettes. And then one of the things that's particularly worrying is that the Health Research Board published a study where they reviewed all of the different work that had been done internationally, looking at what happens when children and young people who don't smoke start to vape, and whether or not those children then are more likely to go on and start smoking. And what they found was that children and young people who don't smoke but start to vape, they are at a 3 to 5-fold increased risk of going on then and starting to smoke. So all of those factors together would signal to us that there is harm associated with e-cigarettes and vaping for children and young people. There are absolutely no benefits, and it's really important that we do everything that we can to protect children and young people when it comes to vaping and e-cigarettes. And one of the big measures that we're going to see hopefully introduced this year is new legislation from our Department of Health that the Minister announced at the end of 2022, which is a tobacco and inhaling nicotine products bill, which will for the first time in Ireland put in place legal protection to safeguard children in relation to the retail of e-cigarettes and vaping devices.
So when you say safeguard children, what do you mean?
Well,
you won't be able to buy cigarettes, or what does it actually mean?
The sad reality, Noreen, and I have a kind of a heavy heart even just saying this, which is that today a kid in Kerry, in the Midlands, in Dublin, can walk into a vaping shop and they could be sold a vaping device and e-cigarette liquid without there being any accountability for the retailer. So I know that people will find that quite surprising.
Wow, I'm actually shocked. I didn't know that.
Yeah, so that's a really big gap in terms of the protection of children and young people. And in fact, I'm sad to say that Ireland is quite an outlier because most other countries have moved on this and they've put appropriate regulations in place. But look, it is positive that that piece of legislation has been announced by the Department of Health, and look forward to working with them in terms of the
when
passage of that.
When will that come in?
We're expecting that to be discussed in the Oireachtas this year in 2023, and all being well, hopefully we will see that enacted before the end of the year. And
well, you'd want to really at this stage.
Absolutely. I think there's huge urgency around it because, Noreen, in my own working life, kind of involved in lots of different things, and, regularly in contact with people who deliver our stop smoking services across the country. But one of the saddest things that I experienced back in 2022 was a contact that was made to me by one of our stop smoking advisors in a part of our country, who was reaching out to me for advice because a young person in their early teens had presented to their service with their parents who was addicted to vaping, and she was wondering what she could offer in that situation. I mean, that child was in a situation where they were finding it difficult to stay sitting in a classroom all day because they were so addicted to vaping. So I think that sort of, really, really characterises
and the effect
problem
that the nicotine was having on her to be able to sit in the class. She was craving it.
Exactly. So look, I think absolutely we need to get moving on that. The legislation will help. There's work that we're doing within the HSE as well. So, we have developed new resources for schools through our SPHE programme. We also have community-based initiatives like Planet Youth that are building capacity within our communities in terms of helping children live their best lives and trying to protect them against the harms that relate to a number of different substances, including e-cigarettes as well. But I think the legislation will be very important because it'll put that safeguard in place, and I think it'll really signal and cut through maybe some of the noise that people have and some of this kind of mixed messaging. Oh, is this good or is this bad? It'll be very clear then that in terms of children and young people, this is a harm, no benefits, and they need to be protected. I think then, you were talking about adults and people who currently smoke, and I think there is a question, and people will be aware that in other jurisdictions, in the UK, for example, they might say to people who are thinking about stopping, well, look, you might try an e-cigarette as a way to stop. So here within the HSE, back in 2022, we published Ireland's first National Stop Smoking Guidelines. I chaired that group. That was a wide group of a number of different experts, including patient representatives, people who had previously smoked. And we went through a very robust and comprehensive process where we looked at a wide range of different studies and evidence, some of which was collated for us by HSE Quit, that people will be aware of, and also by the Health Research Board. And we looked at the question of e-cigarettes and whether or not we would recommend them as a way that might help people stop smoking. And, I remember when I was chairing the group, there was a lot of sort of debate around this, and people had different points of view. And I said to people, look, it's really important that we keep a level head here, and we look at this question in terms of whether e-cigarettes might help in the same way we would look at anything else that might help. So whether that was behavioural support, whether that was nicotine replacement therapy, whether that was acupuncture, hypnotherapy, whatever. Let's just apply a standard process, a set of questions to this proposition. Should e-cigarettes be used to help people stop smoking, and see, does it stack up? And if it does stack up, then we'll have to recommend them. And if it doesn't stack up, then we say that. So the questions that we asked were, well, look, the first question we asked was, do these things work? Are they effective in helping people stop smoking? So we were supported there by an evidence review that was conducted by the Health Research Board. And they found that the studies that looked at the effectiveness of e-cigarettes as a way of helping people to stop were mixed. They had mixed findings, and overall they had low confidence in relation to that evidence about whether or not e-cigarettes help people to stop smoking. So in terms of effectiveness, I don't think we were satisfied that there was robust evidence that e-cigarettes currently are an effective way of helping people stop. The next question then is around safety. So we know that e-cigarettes are not without harm. And the other thing is there are a lot of unknowns around them as well. So it will take some time, a number of years, for studies to be conducted where we have a better view in terms of what the long-term safety profile is associated with e-cigarettes. And I think importantly for us as well, and we'll be probably talking about stop smoking medicines, when as a healthcare professional we recommend to somebody who's smoking that you might try a stop smoking medicine, with great confidence in that because they're regulated. We know that the Health Products Regulatory Agency is involved there, and they can stand over these products. There's checks and balances in place, but there just aren't the same checks and balances in terms of safety when it comes to e-cigarettes. And then the last thing is we kind of asked ourselves the question, well, look, is this clinically sound? And I suppose from our point of view as a guideline development group, we recognise that there are already a range of different supports that are available to people that we can be confident work, that we can be confident are safe. So why would we take a risk with something that we're not sure works, where we have a lot of questions in terms of safety. And we think at the moment, it's better to focus people's advice in on directing people who are smoke and are interested in stopping smoking to things that we know do work and are safe. So that would be things like behavioural support from the HSE, and that would be things like stop smoking medicines, nicotine replacement therapy. But look, this is something that we'll watch and we'll wait and we'll see, so that position may evolve over time as more studies are done. I mean, if we step back and look at it, I mean, e-cigarettes do contain nicotine, and we use nicotine in a controlled and safe way to help people stop.
I just wonder, is that one of the points that people don't understand, that there are nicotine is in vapes, and that's what the problem is. It's obviously in cigarettes you've got all the other ingredients, but it's nicotine that gets you hooked. Absolutely. And I wanted to just ask Sarah, from your point of view, it must be very difficult in the We Can Quit program to. I'm sure, I'm assuming that people come to you and say, but vaping is much better than cigarettes. But I just as well to be vaping.
All we say is we don't advocate for the vapes. It's not something that we think is a good idea. However, people are grown, and it's not our job to tell people, what to do. So all I do as a facilitator is tell them that really there hasn't been enough research put in. We don't know the dangers, and we probably won't know the dangers for many years. And then I'll also point out to them that if they ever watch somebody who vapes, they vape continuously. Yeah. They continuously are sucking on this thing. And we say about replacing one bad habit for another. I kind of say to people, when you have a cigarette, you'll have your cigarettes for 5 to 10 minutes and you put it out and you walk away. When you vape, you're vaping all of the time.
Yeah. Yeah. And Paul, when you going back to giving up cigarettes again and the medication that is available, do you want to just outline a little bit to what is available? Because, like Sarah says, a lot of people, or like we've said, a lot of people may be very tempted to go for vaping.
Yeah, well, look, I think it was interesting to listen to Sarah's story. I think one of the things that you really underlined for us is that smoking is a kind of a complex behaviour, and it really gets tied into people's lives and the way that they live their lives. And one of the things that we've done within the HSE Tobacco Free Ireland programme, one of the things that we deliver is the mass media campaign, the Quit campaign that people might have seen on television and radio. And it was interesting listening to Sarah there, because I was thinking about the discussions that we would have had back in 2022 when we were developing the new Quit campaign. And one of the things that we do when we develop those campaigns, the very first thing we do actually is we go out and we speak to people who smoke, because we want to understand what their lived experience is and how do we kind of connect and engage with them. And we heard themes very similar to what Sarah was talking about there. So we heard from people about the control that smoking has over their lives. So we heard about people telling us that they were leaving kind of, social situations, parties, birthdays and things like that to go out and smoke. They told us about the control that smoking has over their pockets. So, people will tell us about the fact that they're needing to spend almost €100 a week or €5,000 a year if they're buying cigarettes. They told us about the control that smoking has on their day-to-day habits. So how they live their day, and they're thinking, can I go out here and smoke, or where am I going to buy a packet of cigarettes as well? And when we reflected on that, we recognised that actually what we really needed to call out as the Tobacco Free Ireland programme with our new Quit campaign is the control that smoking has over people's lives, and the fact that smoking is an addiction. Yeah. It's a psychological component to that addiction. There are physical components to that addiction as well. And I think when you help to reframe smoking, which people will often say, oh, that's somebody's choice, that they're smoking. But actually, when you call out that smoking has control over their lives, that this is a physical and psychological addiction, then when people think about it that way, you would think, well, how would you try and overcome any addiction without reaching out for support, which is exactly what Sarah did. And in terms of the support that we can provide within the HSE Tobacco Free Ireland programme through our Stop Smoking services delivered nationally, we provide people with a combination of behavioural support, which is sitting down and talking with somebody about your smoking behaviour and having a programme in place in terms of the skills to help you through kind of cravings and the potential to relapse.
So the trigger points exactly, that Sarah mentioned.
That's it. So there's a behavioural component to that, which addresses the psychological components of the addiction. And then we also recommend that people would use stop smoking medicine. So we heard from Sarah out that Sarah used nicotine replacement therapy. And what I noted when Sarah was talking about nicotine replacement therapy is that she used combination nicotine replacement therapy.
Right, okay.
So that is where somebody uses nicotine replacement therapy both as a patch, which slowly releases nicotine into somebody's bloodstream over an extended period. So you're providing somebody with a baseline level of nicotine to help them with their cravings as they come off cigarettes. And then she combined that, or she used combination therapy, because she also used a fast-acting form. So in Sarah's case, that was a chewing gum, which a lot of people like. But there are lots of fast-acting forms.
And is this free, Paul? Is it free?
Well, I was going to go on and say one of the measures that we put in place last year and that is in place now for 2023 is that we have free nicotine replacement therapy available through our Stop Smoking services.
For everybody?
For everybody. So many, a number of people who use our services would have a medical card, and obviously, they can link back with their GP and have a prescription written and go to a pharmacy, and but there are particular sort of rules around that as well, and there are a number of barriers in place. And then for other people who maybe don't have a medical card, we had heard from them that the cost of nicotine replacement therapy was a barrier as well. So we put in place measures to overcome that barrier and make it easier for people to use nicotine replacement therapy. Of course, I would always say to people as well, look, if you step back from it, the investment that somebody would make in nicotine replacement therapy is a drop in the ocean versus what they would be spending on cigarettes. So,
or what are you dropping the ocean of what they'll be spending if they're admitted to hospital with some kind of
and actually a very
illness.
Good point, Noreen, because from our point of view then, when we were discussing it within the health services, our view was, well, look, the money that we would spend on providing people with access to free nicotine replacement therapy is a drop in the ocean versus what smoking is costing the health services on an annual basis. So the smoking costs the health services at least £500 million each year.
Incredible.
So every time, to put that into context, every time that we spend €100 on providing health services here in Ireland, €2.50 of that is spent treating harm that's been caused by smoking. So the very small investment that we make in terms of providing people with free nicotine replacement therapy, we feel is money well spent, because we know that nicotine replacement therapy, particularly when, as Sarah said, she combined it with a program of behavioural support, that offers you the best chance of becoming smoke-free. So if somebody uses a combination of behavioural support along then with combination nicotine replacement therapy, they can increase their chances of becoming smoke-free by up to 4-fold.
That's amazing. And Paul, one of the things I was thinking about as well is GPs and the importance of GPs. I mean, they're the people that the public go to if they've got an issue. But do you think they really speak openly to their GP about smoking, or does the GP bring it up with them and say, look, have you thought about this? Should it be part of every visit to the GP or should it be part of every visit to the hospital? Again,
really interesting, if you think about the sort of myths or misconceptions that there may be around smoking. So I talked about that misconception that, somebody is smoking, that's their choice. That's a misconception. It's an addiction, and then the other thing that you'll hear is, if somebody smokes, they don't want somebody asking them if they're talking about their smoking and that they should stop.
Yeah.
Actually, that's not the case. Through our annual Healthy Ireland survey, we know that 2 in 3 people who smoke tell us that they're actually interested in quitting.
2 in 3 people.
2 out of 3 people who smoke have a positive intention towards quitting. They're interested in quitting. And the next thing is, 1 in 2 people who smoke will have made at least one quit attempt in the previous 12 months. So there's a huge interest among people who smoke in quitting. Actually, we have more quitters than smokers in Ireland at the moment.
I've heard people say, smokers say, as a smoker, every day I think about quitting.
That's right. Yeah. So absolutely. I think it's very important for the public generally, but particularly for our healthcare professionals, coming back to what people can do in our health services, to be aware that people that are using our health services who smoke, that they would be interested in quitting. And so one of the things that I mentioned, Noreen, is that in 2022, the Tobacco Free Ireland programme within the HSE, we launched Ireland's first national stop smoking guidelines. So I chaired a group that developed those. And as I said, we went through a very robust process. We looked at lots of different evidence. We looked at practice in different countries. And we have for the first time consolidated a guideline which sets out what we think is effective, safe, clinically sound care for somebody who smokes when it comes to stopping smoking. And, we're now working on the implementation of those. And the reality is there's a huge opportunity for healthcare professionals to raise the question of smoking with people using our services. Actually, sadly, through our Healthy Ireland survey, people who smoke would tell us that 7 out of 10 times that they saw a healthcare professional recently, the whole issue of smoking wasn't raised with them.
It wasn't. I thought you were going to say, do we not have something
no.
called making every contact count?
We do have that. So I think there's an opportunity to bring together making every contact count with our new National Stop Smoking guidelines to try and work with our healthcare professionals who, are doing busy jobs under challenging circumstances and they want the best for their patients, to sort of recognise that if they can just take that moment when they're interacting with a patient to address their needs and interest in stopping smoking by raising. We know that if a healthcare professional asks somebody about their smoking, if somebody says, I do smoke, if they say to them, that's quite bad for your for your health.
Do you think, Paul, a lot of our healthcare workers smoke? Is that the difficulty? So they don't want to be preaching if they're the ones a lot of them are smoking themselves?
No, actually, in fact, healthcare professionals versus the general population, there's a lower prevalence of smoking. So the issue, I don't think, is around, the smoking behaviour of our healthcare professionals and that being a barrier to raising it. I think the reality is we all know that healthcare professionals, they're under pressure, working in difficult situations. But we know that if they implement in their practice that moment of asking about smoking, then if somebody says they smoke, advising them about the harms. And then the third step is arranging support. So, pointing somebody to quit.ie, 1-800-201-203, referring to our Stop Smoking services. We know that those steps, if somebody who's delivering healthcare services, a general practitioner, a general practice nurse, somebody in a hospital setting as well, if they do that with somebody who smokes, who's using our services, that can double their chances of becoming smoke-free. And it only takes about 30 seconds, And as I said to you, the thing is, that is something actually that somebody using the services wants and expects. A lot of research has been done around this. And when you speak to people who smoke, who use our healthcare services, and we know that people who smoke often have chronic disease, so they can be heavier users of our health services than other people. But they themselves actually are quite surprised when they come through the service and nobody has stopped them and said, actually, are you a smoker and that's not good for you and here's how we can help. They're expecting that. Yeah. So I think it's about us putting the enablers in place for our healthcare professionals so that they can do the right thing.
So we want to flip that and say 7 out of the 10 times that I've met a healthcare
10 out of 10, Noreen.
10 out of 10 that I've met a healthcare professional, they actually ask me about my smoking.
But and that's a huge opportunity.
Yeah.
It sounds like a small and a simple thing, but if you step back from it, and if you think about 100,000 people working in the health services. If you think about the number of interactions that there are with members of the public in primary care, community services and hospital services, if you think about the fact that 1 in 5 people in the population smoke, higher among people who are using health services because smoking causes chronic disease. Actually, if we make that small change and use that opportunity to make every contact count, actually the impact on the public's health could be huge. So look, we're working through the Tobacco Free Ireland programme and with other colleagues in health and wellbeing to try and make that ambition a reality for our health services, so that we have an actual health service and not just a sickness service, but a service that is trying to work with people to help them maintain their health and try to prevent disease. Yeah.
Thank you very much, Paul, for all of that. And Sarah, it sounds like it's a slow process to give up cigarettes. And it's a difficult process to make that first step.
Yeah.
So if you were to talk to somebody sitting at home now or whatever, listening to this podcast, what would you say to them about making the first step? What would you say to encourage them to do it? And how would you get them to just take the chance in giving up cigarettes?
Well, I'd tell them if they really want to give up smoking, just make the call or ring their local partnership. And what they can also do, if they don't want to walk into the group because maybe, like myself, they're stay-at-home moms and their confidence is a little bit low, they can always ring the number and then they can end up talking to a community facilitator, somebody like me, and I would just talk them through the programme. I'd make them feel very welcome. I think just pick up the phone, know that there's help available.
Paul, where are we now? What are we going to do? What are the quick wins? If you had 3 things that you could say in 2023
I think in terms of trying to tackle this problem, look, in terms of 3 areas for focus. The first is to try and get implemented into daily practice and try and make sure that all of our public experience the things that we know work in terms of helping people to stop smoking. So, this year within the HSE, we're expanding our stop smoking services. We've 50 new stop smoking advisors. We've a new campaign. We're making nicotine replacement therapy free. So, and then as I said, we're trying to work in terms of implementing new national stop smoking guidelines within our services. So, rather than doing something brand new, I think the first thing will be actually to focus on implementing and getting into practice the things that we know work. The next thing is, Noreen, I think we do need to focus in on children and young people and make sure that they're protected. So we've already spoken about the gap that there is in terms of protecting children and safeguarding them against the sale of e-cigarettes and vaping devices. So really welcome the news from our minister at the end of last year that there's new legislation coming forward, and I think we need to get that into place. I think we do need to be stronger and clearer in terms of the harms that are associated with vaping. But look, the third thing I think that we need to do then is, I think collectively, like we've come so far. I've talked about the reduction in smoking prevalence since the late 90s, down from 1 in 3 now to 1 in 5. And I talked about the fact that we have done that collectively as a country because we've changed our norms, our attitudes towards smoking. I think there's a real opportunity for us to sort of reframe this. So I think heretofore we've been quite focused in on trying to control the harm caused by smoking to the population. So look, let's try to get it down to a lower level, and that would be really good. But we have to stop and say, like, is it still in 2023, given everything that we know about the harms caused by smoking, acceptable that 100 people in Ireland are dying a week from smoking? I think there's a real opportunity for us to bring that problem to an end and to eliminate the harm that's caused by smoking completely. In fact, that is at the heart of the 2023 government policy document, Tobacco Free Ireland. It's in the title. So the ambition is that we would have a Tobacco Free Ireland. And what that means practically is that smoking prevalence would be less than 5%. We are off track and we're not going to deliver that goal. So that goal of a Tobacco Free Ireland was set in that 2013 government policy document for 2025. In terms of where we are at the moment, we're not going to meet that. So I really think it is in our collective interest that we would renew our focus on that as a goal, so that, acknowledge that we've done a good job in terms of controlling tobacco and smoking related harm, but we now need to get serious about eliminating it completely. And I think we can do that because if you look at, for example, New Zealand, people may be aware that last year they announced really ambitious a package of policy measures that have the potential to eliminate the harm caused by smoking. So they're talking about establishing a tobacco-free generation. They're talking about reducing or eliminating the nicotine content in tobacco products, and they're talking about radically reducing the retail footprint. So
reducing the nicotine in tobacco products.
That's
so it's really just, can science and technology get together to really help this problem?
Absolutely, Noreen. So look, I think there's a real opportunity for us to innovate,
to
try and eliminate the harm that's caused by smoking. So one of those innovations would be effectively to turn the industry back on itself. So we know that the reason that people smoke tobacco is because of nicotine. We know that nicotine is the what causes the addiction, and it is technically feasible through product innovation to reduce and eliminate the nicotine content in tobacco products, and that would actually make them less addictive. So people who smoke aren't smoking for the taste of it. They're smoking because they're addicted to nicotine. So that is one of 3 tobacco endgame policy measures that were announced in New Zealand, and that collectively, together with then the tobacco-free generation and reducing the retail footprint, have the potential in New Zealand to eliminate the harm caused by smoking, bring it to very, very minimal levels. And I think, as I said, Noreen, in 2013, we were all very pleased to hear our government committing to that goal in Ireland. So that goal was set, the target for that was set in 2025. We're not going to meet that. I think it's really welcome that we have the piece of legislation that's coming forward this year that's going to strengthen the licensing of the retail environment and address that issue in terms of the sale of e-cigarettes and vaping devices to children and young people. But I think there's an opportunity with that to review where we are with that Tobacco Free Ireland goal, to recommit to it and get a very concrete plan in place to deliver on it. And you know what, Noreen? The thing about that is that's something that would have huge public support. So within the Tobacco Free Ireland programme, we went out last year in 2022 and we asked the public what they thought about a Tobacco Free Ireland, that idea of eliminating the harm caused by smoking. And actually 3 out of 4 told us that they supported it. 3 out of 4 thought that it was achievable. So it wasn't just wishful thinking. They actually
Paul,
thought this
we
could
never
be done.
thought that the smoking environments would ever be achievable in Ireland. And look how we were the first in the world to do it.
There's a great quote. So look, I know sometimes when I talk about these ideas and this idea of Tobacco Free Ireland and all of these different measures, people might roll their eyes and think, goodness me, like, would we ever do that? There's a great quote by Nelson Mandela. He says, everything is impossible until it's done.
Exactly.
And if you think about it, the night before we went to smoke-free bars in Ireland, everybody was thinking this is not going to happen. And within a week, it was all fine. The same with the plastic bag tax, etc. I think this idea of a tobacco-free Ireland, as I said, when we went out and asked the public, there's huge popular support for this. So 3 out of 4 support it, 3 out of 4 think it's achievable. In terms of these really bold measures, and I talked about some of those bold measures from New Zealand. When we went and we asked people in Ireland their thoughts on those, and they were hearing these ideas for the very first time, actually there was a majority support for most of them, including high support among people who actually smoke, who are probably worried about the next generation as well. So I would think from a political perspective, there's a huge opportunity here in terms of leadership and a legacy to be the political leader that would take those bold measures, get a really concrete tobacco endgame plan in Ireland that turns that bold ambition into a reality.
Well, thank you very much, Paul. I think that your enthusiasm and motivation for a tobacco-free Ireland is contagious. And again, thank you very much, Sarah, for joining us today. For those of you who want to quit, please go to quit.ie to get support free of charge from the HSE. And again, thank you both of you for joining me today for the HSE Health and Wellbeing podcast.